In intrahepatic cholangiocarcinoma, what we have recognized is that the most common mutations are mutations in IDH1, which is isocitrate dehydrogenase 1. That's seen in about 20% of intrahepatic cholangiocarcinomas. We also see FGFR2 fusions. So these are FGFR2's genes that are fused to a number of different partners. And taken all together, it's seen in about 10 to 15% of intrahepatic cholangiocarcinomas. So that's the largest chunk of the patient population. But then there are rarer but still potentially actionable targets like BRAF mutations, which we see in about 3 to 5%, HER2 amplifications and alterations, and then a small smattering of other things, including defects in the homologous recombination pathway. And so between all of those, it's about 30 or so percent of intrahepatic cholangiocarcinomas, or maybe even a little bit more, that have targetable alterations. And that's actually very different than, say, extrahepatic cholangiocarcinoma, where we do not see FGFR2 fusions or IDH1 mutations nearly as frequently, but we do see a higher amount of HER2 amplification, and we can also see a little bit of BRAF mutations, again, in a small subset of patients.